under eye bags at 20? I have bad eye bags under my eyes. My mother also suffers from this, but she didn't develop her bags until she was in her late 30s. It's worse when I smile, obviously, and it looks horrible under normal light. It's worse on one side, which is the side I sleep on. Am I a good candidate for surgery or injections? I also look tired, and I've been suffering with this since I was 16. Any advice would be appreciated. Thank you.
Thank you for your question. You're asking, is it essentially normal to have eye bags at the age of 20? And that you described in your question that your mother got eye bags when she was in her 30s. Well, you are definitely on the right track because eye bags typically are genetic and they do cause people to have them as early as in their teen years. In fact, in our own practice, we've had a patient who was 14 years old and had such big bags under his eyes that he was being teased at school. And so we went ahead and did the lower eye bags and helped him literally change his life because he was being teased for being on drugs because of the bags under his eyes. So essentially, you know that you have bags under the eyes, and what I'm going to do is essentially clear up for you the cause of those bags, and not the genetic cause, but rather what it is anatomically. And those bags represent something called lower eyelid fat prolapse. And what that means is that there's fat that's normally around the eyes, and at various times in people's lives, based on a combination of genetics and some other environmental factors such as smoking and allergies, these fat pockets can push forward. Sometimes they're referred to as herniated fat or fat prolapse. So when you have puffiness under your eyes like that, that automatically makes you look like you're tired. And so people often come to me and they use the phrase that they're tired of looking tired. So what I do for someone who's younger and doesn't have excess skin under their eyes, I will do a procedure called a transconjunctival blepharoplasty. Now what that means is the fat pockets are addressed from the inside of the eyelids. And if you do your research, you'll see a lot of people who claim to do something called fat preserving and fat transposition and all these other terminology, septal tightening. And it's in many ways the lower eyelid blepharoplasty approach has become in some ways similar to the way people talk about facelifting procedures, where some people claim that deep is better than not so deep and things like that. Well, as an expert in this area, I perform all those techniques and I customize them to the patient's needs. But the important thing to remember is that if you have this procedure done from the inside of the eyelid, there's no outside scar, and that's a really big advantage. And so the rest of it is art and finesse, and that's where choosing a surgeon who is very familiar and, in my opinion, at the expert level of performing eyelid surgery, such that all the techniques are are familiar to the doctor. There are other things to help with skin quality and texture, and in my practice, we will sometimes address those at the same time as the procedure, and sometimes, or more often, we'll address the skin issues as an ongoing management and maintenance so that people's eyes look fresh and healthy for as long as they want to have them look their best. So I hope that was helpful, and thank you for your question.